And CBC.
Yes, ma'am. Actually,
We
in the,
recognize Senator Risa Ontiveros.
yes, Your Honor, good afternoon. Actually, in the Department of Health, we have provided additional benefits for our employees through the union. It's a collective negotiation agreement where 10,000 is allocated for check-up package annually for each employee and 50,000 for hospitalization. So if that would be now covered by PhilHealth, I think all the agencies of government can allocate that fund. Because
We
we're
asked
already
Secretary
providing.
Ubial, along with Mr. Basa, to work on that with the heads of agencies and kindly get from LBRMO those agencies which had previously submitted to us already. But we cannot follow that. That was based on 2017. But meaning, they can also find it for this year. Kung saan nila pagkukuhanan, willing nga sila, tulungan lang sila ng PhilHealth. Ayun. So, dapat sa 2018 ay covered na, may parity na ang healthcare services ng legislature at ng executive. And does it cover judiciary? Judiciary also? Or judiciary has the same as legislature, has its own. So we don't have to cover the judiciary, in my understanding, you're sure. We don't leave them out. So it's only the executive that is not receiving the same benefits as the two branches of government. That's very unfair. And I like it to be said that during our watch here, as Chairman of Finance and all our esteemed members, that we are able to give them the basic medical health care. Okay? So 2018, kaya yan ha? Sige. Okay. May I assign request Senators Ontiveros and Ejercito to work on this since I'll be busy with the budget, and this was something that we actually wanted to do since last year. Sen. Risa knows about this, to work with the DOH and the PhilHealth, just to make sure that the intent is accomplished. Okay. Kaya natulungan niyo ako dyan. Sige.
I'll gladly work with my chairman, chair, and with my former colleagues in PhilHealth. And of
Gusto ko
course,
sa minority, very cooperative.
on this issue, yes, Madam Chair.
Senator JV, you have any questions?
Just like that, so going back to the concern of our chair, PhilHealth, we always talk about coverage, but what is more important, measure of success, yung utilization. So, do we have meron ba tayong figures about the utilization on the lower income bracket, especially yung poorest of the poor? Kasi kanina, you talked about yung sometimes lack of information, so yung just the figures, Mr. Basa.
Yes, Your Honor. Good afternoon. As of 2016, in terms of benefit payments for our sponsored indigents, we paid for 2016 30.9 billion pesos in benefit payments. And as of June of this year, we have already paid 15.3 billion for the indigent sector. For the senior citizens, Your Honors, we have paid 25.1 billion in 2016. And as of June of this year, we have already paid 14.1 billion for senior citizens.
Thank you for that. Likewise, may we just know yung siguro yung difference, so how much did PhilHealth pay for private hospitals vis-a-vis government hospitals?
Yes, Your Honor, we will submit, Your
Yes,
Honor.
please submit to the committee.
So the work will be made easy when we will just have a special provision in every department in the executive that we will allow them to realign so that the medical health care benefits of PhilHealth will be provided for, expanded, yes. Okay. She'll do the wording. Senator Subiri.
Thank you, Madam Chair. Madam Chair, I know there's several other topics and agencies you would like to talk about and discuss their budgets and advocacies and priorities. But on one issue, aside from PhilHealth, good afternoon, Secretary. Good to see you. Yeah, we'd like to ask if there's a plan of the DOH to establish specialty hospitals as well in the Visayas and Mindanao, because I represent that region, and we have difficulty, with patients from the Mindanao area that have heart problems. They have to travel all the way to Quezon City in Luzon to take care of their concerns on heart, kidney, lung. Is there a plan by the DOH to come up with this specialty, even, assigning regional hospitals a specialties area or a center within the regional hospital that can deal with this type of issues of health?
Yes, sir. We have already planned heart, lung, kidney centers in 8 priority areas nationwide. And currently, one is operational in Mindanao, that's the Southern Philippines Medical Center. But another one is upcoming, the Northern Mindanao Medical Center. And in Visayas, there are 2 in the pipeline. One is already operational, that's the Central Visayas in Vicente Soto, and another one in Western Visayas, Iloilo. And then in Luzon, there will be 4 heart, lung, kidney centers outside Metro Manila.
When you say, thank you, Secretary,
Yes.
Madam Chair, when you say specialty center, heart, lung, kidney centers, are they capable of doing, for example, open heart surgery in this area? So we'll be assigning specialty doctors there as well.
Yes, sir. Currently, the Philippine Heart Center is training all the doctors in the identified heart, lung, kidney, and the kidney center and the lung center also are training the doctors. So they are ready for deployment in the specialty centers outside Metro Manila.
When you say the one in Southern Mindanao, is that already operational? I mean,
Yes, sir.
Patients can be directed there already.
Actually, we opened the heart center in Southern Philippines when I was still regional director there in 2007. So when we started, we were doing around 20 open hearts a month. They're now doing more than 40.
Oh, very
month.
good.
Yes.
So we don't need to institutionalize it anymore by filing bills because it's already being done. Or
Yes.
would you still prefer that we file legislation to that effect to institutionalize it?
We already have the Philippine Health Facility Development Plan 2017 to 2022. It identifies all the specialty centers that will be put up. I just hope we get the budgetary support for that, for the Philippine Health Development, Health Facility Development Plan.
What I asked, Madam Chair, is
Is it in the net?
Part of it, but there's still a lot of balances. Actually, our original proposal in the 2018 NEP is 39 billion. It's now 29 billion.
Ano po ang nawala sa 39 at 29, yung diferensya?
10
Nasaan nga? Ibig sabihin, marunong ako magbilang. Ibig sabihin, saan yung lugar? Saan pong lugar?
Lahat daw ho ng various levels of the healthcare system, barangay health station, rural health unit, polyclinics, and hospital beds na bawasan po lang. Because the plan, we will provide all the senators this encapsulated version of our Philippine Health Development Plan. This was approved by the Cabinet and the President. And the plan is to have at least 1 barangay health station and 1 professional per barangay, 1 rural health unit for every 20,000 population, 1 polyclinic for every 50,000 population, and 1 hospital bed for every 800 population. So with that, we're actually seeing a gap of around 42,000 hospital beds across the country. We lack 1 barangay health station. The gap is around 9,600 barangay health stations and rural health unit of 5,250 and hospital beds of 42,856 So
Sec,
we have that.
Pero Sec, di ba ipinasa po natin yung sin taxes, and sin taxes contribute, I think, about maybe 80, if I'm not mistaken, billion a year. Doesn't go directly to the DOH services. So is that not enough for the funds that you're requiring for this program?
Actually,
Could you
sir,
update us on the numbers? What's the numbers, ma'am? if you
the
know?
around 100 million of the sin tax, we're getting around 107.53 of the sin tax, and 57 billion of which goes to PhilHealth premium payments. So the balance of that is added to the DOH budget to be allocated to various health programs. But
Aside from the NEP, ma'am, aside from what the DBM gives you, this is over and above?
yes, sir. The net is actually pegged at 53.2 billion.
So 53.2 billion,
Yes,
then you have 107 billion from sin
107.
taxes.
Yes,
So, hindi pa kasya yung pera niyo, ma'am?
yes, yes, sir. Because our lack or our neglect is actually for so many years that we have not had capital outlay. We started the health facility enhancement program in the DOH only in 2007. So 10 years pa lang po tayo, and we started with 500 million and 1 billion a year until yung pinakamalaking budget, which is 9 billion. But before, mga 1 billion, 2 billion. So there's really a lack of health facilities in this country.
We could ask the DOH, Madam Chair, to submit to us the breakdown of the funding. Is it here? Because it just doesn't say what is missing from the budget that you've been receiving. It says here the total investment that you need is about 228 billion. But for this year alone, how do we close the gap between this with the amount of money that you're actually getting earmarked from the sin taxes?
We're actually proposing, if we're going to cover the gap within the next 5 years, we're hoping to get a 40 to 50 billion budget for health facility enhancement every year.
That's the balance of the PhilHealth.
Yes, sir.
Na 50 plus billion.
Yes,
So
sir.
yung balance nun, dyan pupunta. So
Yes.
tama-tama 5 years ang tinitignan ninyo.
Yes, sir.
Okay.
That's it.
So, on another note, Madam Chair, we'd like to also ask the good Secretary, I know, and that's why I support her very much, Madam Chair, because I believe that she's one with the President in trying to bring down the cost of drugs. And it's been almost 8 years since we passed
Drugs.
No, I mean, medicines. Not the prohibited drugs. Yes, of course.
Clarify, because
Absolutely.
anyone, we're on Facebook Live, anyone can get your soundbite and then say, she's bringing down the cost of drugs. Diba? And just
Yes, sir.
post
Medical
it.
drugs,
Okay.
Madam Chair.
I understand naman. Para lang
So,
okay.
ibang hearing yun. Siguro sa public order, sige. But on this issue, it's bringing down the cost of medical drugs, medication. And it's been almost 7 or 8 years since we passed the Cheaper Medicines Act. And I think we have improved in terms of generics. We have the generics in place. But yet, there are several specialty drugs that are not covered by generics. And these are for patients with heart problems, with cancer, with hypertension and all that. And it still alarms me, Madam Chair, no, Secretary, you know this. I'm preaching to the choir. I mean, you guys are with me in this. We are looking at prices that are so extremely high that in other countries the same brand costs 1/3 or 1/4. As a matter of fact, as chairman of the Committee on Trade and Industry and Commerce, I'm in charge of the Cheaper Medicines Act Oversight Committee, and they're spending proposals on that. And that's why I need to know what the pulse of the DOH is. Do we need these particular pieces of legislation, or are we going to be able to do this on your level, Madam Secretary? Kasi sa hearing, one time I was invited to the American Chamber of Commerce. Hindi ko pala alam, marami pa sa kanila, pharmaceuticals. So, tinanong nila sa akin yun, yung bill ni Congressman Biron on the creation of the Price Regulatory Board. And I told them, you know what? Give us an excuse not to pass this. Because right now, it's a dismal failure. Your plan to have it done through just within themselves having a competition, like what you call price competition. It has not worked. And I told them, shame on them. I don't think I'll be invited to their meeting again, because I told them, shame on you when our people are dying, because at that time I had the staff that died of cancer, could not afford your medicines, when in India and Thailand and other countries, mas mura po ang gamot dun sa kanila. Shame on them. Sabi ko, nakakaya kayo. Hindi na ako sinagot. So,
Yes, sir.
naman eh.
Yes,
So, Madam Chair, tell me what we need to do para we can support this program.
Yes, sir, that is true. We have implemented the cheaper medicines law, and it has actually improved to a certain extent our drug prices in the country, but it is not enough. We believe it is not enough. That's why we are actually supporting the law for the Drug Price Regulations Act, meaning that we will now have a regulatory body that will look at drug prices on a periodic basis and recommend to the Secretary and the President which drugs will be placed under maximum drug retail price recommendation.
Maraming salamat, Madam Chair. I'll end mine. I have a few more, but I'll end because I know we're running out of time. But
just for the information of everyone, while we have we will suspend our hearing at 3 o'clock and go for the roll call. But I just asked my staff to go to the majority office to request for a suspension of the rules. After roll call, we will come back here and continue our hearing at 4 o'clock, so we finish it today. I don't want to postpone another day again. So when we suspend at 3 o'clock, you can have merienda, then we come back after 1 hour. So we finish your budget today, regardless of what time hanggang ngayong gabi.
you, ma'am.
Okay, thank you. Because I know Senator Joel has lots of questions. and
one more
Senator
minute,
Lisa. So maybe
a few more minutes.
just in the order of arrival, no? Ito Senator Binay, Senator Ejercito, Senator Zubiri, Senator Villanueva, then Senator Ontiveros. So after Senator Zubiri, we have Senator Joel, then Senator Risa.
Thank you, Madam
May
Chair.
follow-up lang question, if
Yes,
you
Madam
allow,
Chair.
Senator Risa.
Thank you, Madam Chair, and thank you to Sen. Migs. I just wanted to follow up that nawala yung aking page. Oh my goodness. What happened? Wait a minute. Sorry, Madam Chair. Ayun. During the past two hearings of the Quality Affordable Medicines Oversight Committee, chaired by my chairman, Chairman Migs, the DOH committed to releasing that maximum drug retail price in the Q3 of 2017. So could the committee just briefly know the status of the initiative, and when will the MDRP be released, Madam Chair? Thank you.
Yes, Your Honor, Madam Chair. Actually, I was ready to have that signed by the President before the SONA. But I asked the members of the Advisory Council at that time to have a market sounding and to also consult the stakeholders. So they've been doing that this August, and we're ready to submit once again to the Office of the President the list that we are looking into, about 12 components, molecules that are actually commonly used, and also some of them have no alternative generics equivalent. So it's really high impact medicines if we can put them under maximum drug retail price.
Thank you, Madam Chair, and I will support that, and I'm certain my Chairman Migs, will support that as well. Salamat po.
Thank you. Yes, actually, I have my draft bill. Because of what you said, I'll sign it today and we'll file it, so that you'll have a counterpart measure in the Senate as well. But I need your support with the DOH. Akalaban natin ito, mga higante. mga higante, and they will actually put up a big fight. The lobby there is immense. But we're looking at the future of the Filipino people. We need the support of the DOH to come out strongly and say we need to do this to finally bring down these life-saving drugs.
We can show you the statistics, Your Honor, that some of our drug prices in this country under the drug price monitoring index, similar to Thailand, it's 7,000 times higher in this
Ano po,
country.
pakiulit po, 7,000, hindi 700, ha? 7,000 po ang, higher.
Yes.
Napakagrabe. And ang tao,
And it's the same reference
araw-araw dahil dyan.
statistics. It's
Same,
drug
is it
price
also the
monitoring.
same manufacturers? Same companies?
Yes, sometimes.
Yeah.
Pero yung iba kasi generic equivalents, but it's the same molecule.
Oh my goodness. Thank you, Madam Secretary. And on the last note, before I end my interpellation, just really quickly, we passed 2 weeks ago, Madam Secretary, and this has been my advocacy as chairman of the Trade and Commerce Committee, Senate Bill number 1311, 1311. This is our expanded Anti-Red Tape Act, authors of which is Senator Joel here beside me, Senator Ping, Senator Recto, and myself, and of course all the members that are here on this table. We unanimously approve this. This gives prescribed processing time. And I know the DOH, together with its attached agencies like the FDA, they deal with clearances, permits, and licensing. So right now, we'd like to remind everyone in this room, especially those in charge of agencies that give out licenses, clearances, and permits, that if we approve this, hopefully by the end of the year, the maximum number of days for MSMEs, these are simple transactions, are only 3 working days. The more complex MSMEs, this is the micro, small, and medium enterprises, is 7 working days. And then for those bigger corporations like pharmaceuticals and other food processing plants, etc., and all government agencies, Your Honor, Madam Secretary, is 20 working days. Under which, if it is not approved by them, it would be deemed approved automatically. And if it is not deemed approved, then it's still held in abeyance for no apparent reason or no cause or validation. There's specified very strict provisions on penalties, including jail term, ma'am. So ayoko naman makulong yung mga taga-FDA or taga-DOH. We just want a more efficient government bureaucracy. The President has been saying this time and time again. He wants to streamline red tape, and take away red tape and streamline the bureaucracy rather. So if we can assist the President in this, with this expanded Anti-Red Tape Act, I hope we can also comply with the DOH. Don't worry, ma'am, I'm not singling out the DOH. In every budget hearing of Madam Chair Lauren Legarda, I'm here to remind all the government agencies about our new expanded Anti-Red Tape Act. So maraming salamat po, Madam Chair. Thank you.
Yes, thank you. We will support that, Your Honor. Actually, we've started a lot of initiatives in DOH. Particularly, we have marching order on no queuing. And we hope to actually implement that in our DOH hospitals through appointment systems, so that patients that go to the hospital are not walk-in. They are referred from the health center to the hospital, so that they don't have to queue because they have an appointment schedule. We're also trying to do that with UPPGH, one of the concerns also of the President. Yeah.
But I just like to ask Secretary Bell, how do we solve that problem? Because I have gone around now. Most of the patients, indigent patients especially, they go directly to the hospitals, which is one of the reasons why most of our hospitals are really congested. Talagang hindi dumadaan ng ng primary or ng health center. So how can we do that? Is it improvement of health facilities?
Yes, Your Honor. Actually, what we hope to attain that when we have one health worker per barangay, and we're actually providing tablets, hopefully, to all health workers so that they can make the appointment for the patient to go to the hospital. So if the patient's appointment is 9 o'clock, they just appear there at 9 o'clock. They don't have to come there at 3 a.m. to get the number so that they'll be seen by 9 o'clock. And then for patients who cannot be accommodated in government hospitals, we're trying to also work with the private hospitals. Like, for example, we give them a quota, like 50 patients a day. So if they cannot be accommodated, for example, at PGH, then we can refer them to the nearby private hospitals. So that's how we're trying to move this particular initiative forward. No queuing.
I'd like to just put on record that I support the budget of the DOH, and if we can assist them even more, it would be a welcome, I guess, development for the DOH. I support them fully. Thank you, Madam Chair.
While Chair is still busy, I'll just take this opportunity. 29 billion out of 60 billion budget of your organization outcome is allocated for health facilities enhancement program. Just like to ask...
May we recognize Senator Sherwin Gatchalian? Then proceed.
Okay, how much of this budget allocation will be used for the construction of new hospitals, barangay health stations, rural health centers? And the priority, ma'am, can you please siguro inform this committee?
Yes, Your Honor, we have a breakdown of that in our presentation. So, for the health facility enhancement of 29 billion. Sana yun? Sana yun? Hindi. Well, sandali lang po, hanapin ko pa. 147 million is for polyclinics, 2.06 billion is for rural health units, and 2.43 billion for barangay health stations. The balance is for hospitals. So we have in the pipeline 338 LGU hospitals to be upgraded and 69 DOH hospitals to be upgraded. And we have several other national government facilities like the treatment and rehab centers, the psychiatric facilities. We have around 13 across the country, and we are in the process of expanding and upgrading the psychiatric facilities. We're upgrading blood service facilities. So we're trying to put up a blood center in every region. Currently, there's about still 5 regions missing blood service facilities. We're also improving the quarantine stations and the regional water testing laboratories, as well as TB reference laboratories in all regions.
So, dun sa 338 LGU and 69 DOH hospitals that will be rehabilitated, does this mean that this will be expanded as well?
Yes, sir. Yes, sir. Actually, as I mentioned, we have a gap of around 42,000 hospital beds. And the way we plan to reach or address the gap is actually more of expanding existing hospitals rather than building new ones, because it's more cost effective. And in other countries, hospitals are up to 3,000 beds. Our biggest hospital in this country is Southern Philippines Medical Center in Davao with 1,500 beds. The UPPGH is actually 1,200 beds only. But we're also helping them to be upgraded to about 1,500. But we're also looking at upgrading the infirmaries to level 1 and upgrading level 1 to level 2 hospitals also across the country.
Likewise, I have gone around also, no? Most of our government hospital, you can expect 200%, 300% capacity. It has been a perennial problem, so we would want to address that, and we're hoping that this committee will be able to address it in the coming years. So what would be the plans to address this? For example, yung Baguio General has 500 bed capacity, but they're servicing about 700 to 800 at any given time. Madam Secretary.
Actually, we're asking, it's in the Universal Healthcare Law that has been passed in Congress already. So that part of the work of the Department of Health is now an administrative function to increase hospital bed rather than it be a legislative function, because by the time the legislation is approved and the bed capacity is increased, then we lack another bed capacity. So what we propose in the Universal Healthcare Law, as soon as the DOH has identified that this hospital, 100-bed hospital, is already admitting 150 beds, then we will license them for 150 beds. And therefore, the LGU or even the DOH can now ask the budget to have the personnel complement and the MOOE to run that hospital on that bed capacity. So that's what we hope to do. And with that also, we're asking in the Universal Healthcare Law that all PhilHealth income, even of local government hospitals, be retained in the hospital and not actually reverted to the general fund of the local government, so that it can be used to upgrade and to improve the services of the hospitals, Your Honor.
Okay, thank you, Madam Chair.
May I have the floor?
Are we done with Senator Binay? She's the first one arrived. Okay, and then we're done with Senator Ejercito, thank you. Senator Subiri also already finished. With Senator Villanueva now.
Thank you, Madam Chair. Good afternoon, Secretary, sa ating DOH family. Before I start asking questions, Madam Chair, if you would recall, about 2 weeks ago, I was supposed to deliver a personal and collective privilege during our session, and I was almost tempted to ask a parliamentary inquiry in the session hall, but probably it would be appropriate for this representation to raise a parliamentary inquiry now if this hearing is far more important than committee hearings, Madam Chair. Because 2 weeks ago, if I recall, with Senator Nancy Binay and Senator J.V. Ejercito, we conducted a committee hearing for the first-time job seekers proposed measure, Madam Chair. And unfortunately, we invited the Department of Health and we received a confirmation from the Office of the Secretary. And Madam Chair, as you very well know, I am not requiring the heads of agency or anyone to attend the hearing. But unfortunately, the Department of Health, after confirming their presence in that particular hearing, no one actually came. And so I wonder...
May we hear from the DOH? Secretary, did you know about that hearing? And we expect all our hearings to be attended by the executive, not necessarily the head of agency, because we know there are congressional hearings on the budget as well. Why was there a confirmation, and why was the DOH not represented?
Yes, Your Honor, I'm sorry. Yes, we did receive the invitation, and I directed our staff to attend. Unfortunately, there were other conflicting activities also at that time. I'm sorry about this incident, Your Honor, but I have marching order to my staff that any hearing in Congress and in Senate is important, and as much as possible a director, no less than a director, should attend the hearings, Your Honor.
Would you agree with me, Madam Secretary, that this hearing is equally important than the hearing that we had 2 weeks ago? Thank you, because I'm not sure if that was the case before, because right now I can see a lot of users, directors present here today. And if it is equally important, I thought at least one director or one representative could attend the committee hearing. Anyway, it's about exempting first-time job seekers from government fees, etc. No? So I hope, Madam Secretary, this will not happen again, because I was really pissed, Madam Secretary, and I was even tempted to defer your budget today because of that, just to send the message. But I'm not going to do that. So let me start my first question on the office of the Secretary. Anyway, we wanted to find out if the office is really efficient. If you're looking at the 2018 budget, the department is proposing a 9% increase in its NEP for 2018 for the DOH Office of the Secretary, but a decrease of 2% for the National Nutrition Council, and a 16% increase in the Commission on Population. However, it appears, Madam Chair, that there is a underutilization on the part of the department insofar as the previous year's budget is concerned. And if you look at historically, halos pare-pareho po, no? Since 2013, I was looking at it, to 2016, yung Office of the Secretary had a utilization rate that ranged from a low of 80%, 83% in 2014, high of 88% in 2015. However, if you look at the previous ones, for 2017, I got a data, July 31, 2017, that you have only 48% utilization rate. Is this correct, Madam Secretary? Is this accurate?
Yes, Your Honor, 48% as of July.
Well, if it's accurate, probably the next question would be, we only have a few months left for the year, and we have to submit a new approved budget to the Office of the President. And every time we tackle budgets here in the Senate, now that everyone's pushing for train, ang laging tinatanong ko sa amin, why do we need to come up with new taxes? Raise the taxes, pero ang daming unutilized. And as you mentioned earlier, Madam Secretary, 48% po yung utilization rate. And again, a few months to go for 2017. So what are we doing, Madam Secretary?
Yes, Your Honor. We realize that there's really a lot of problems in terms of our utilization because of a number of failed bidding po. And we're actually fast-tracking the procurement, and in fact, most of our vaccines are now handled or outsourced through UNICEF, and some of our, shall we say, health facility enhancement are being handled by DPWH. But
Pinasa nyo na po yung iba? Ganun po?
for outsource po, because we really cannot a number of our major procurement is actually for cancer centers, that's 4.4 billion, and 2.6 billion for drug rehab centers, which we actually did not use because of the donations. So if we total this around 7 billion,
But
that's
Secretary,
about
the donation
16%.
will not be reflected of the budget, di ba?
No, Your Honor. The amount of 2.6 billion is still in our budget, but it's for realignment to other projects, but it has not yet been approved by the Office of the President.
Siguro yung main point ko lang, Madam Secretary, you're asking for increase of 9%, but we'll be able to address this problem ba kung sakaling ibigay natin itong 9% increase?
Yes, Your Honor, because the 9% actually only covers 23% increase in personnel services. We have 2% increase in capital outlay and a very small amount or zero increase in MOE. The 9% of our budget increase is mostly PS because of salary standardization.
Sige, I'll go there later, Madam Secretary. You know, I just want you to react on this report also from COA. For instance, they found specific instances of underutilization in the OSEC, which oversees the provision of services in public hospitals and improvements in their facilities. These were enumerated in the COA's annual audit report for 2016, and I think it was transmitted to your office June 30, 2017. For instance, 6 hospitals, sabi po dito, COA found that utilization of the 25% allowed limit use for the procurement of equipment and upgrading of hospital facilities had not been maximized, with only 45.95% or 288.155 million utilized. And if you look at these figures, it will leave you a balance of about 338 million. And then another thing that I want you to react on, Madam Secretary, COA also found charges of 10 million pesos against the income of 4 hospitals that were not within the prescribed usage and authority under the DOF-DBM joint circular. These are just, Madam Secretary, some of specific instances of underutilization that I am a little worried about, and perhaps you can clarify these issues, Madam Secretary.
Before Secretary Ubial answers, may we recognize Senator Cynthia Villar. Thank you.
Afternoon po, Senator. Actually, all the COA observations memo that were submitted to the Office of the Secretary last June 30, 2017 were answered individually. So, mainly the income is actually identifying 25% should go to capital investments. But because of the need for, let's say, supplies and materials, it was used for that particular item. So it was not underutilized. But yes, the GAA actually identified that 25% of your income should go to capital investment. But in some hospitals, that is not followed because they need urgent supplies and drugs. That's why they use it for MOE, not capital investment.
Just to fast track na lang, Secretary, siguro, can you just give us a copy of that
Our answer, yes, sir.
Another thing, we were talking about kanina itong health facilities enhancement program of the Department of Health. May nakita rin po, again, an underutilization issue, no? Yung equipment in various DOH agencies or hospitals in the NCR and regions of 58.199 million are either idle or unutilized due to various defects and non-availability of facilities. Again, it was mentioned in the report. Every time we hear these kinds of issues and news, syempre, tayo bilang public servant, gusto natin na nagagamit ng maigi, efficiently, itong mga pondo na ito. Another, for instance, Madam Secretary, I have done my homework here. It was also found out that HFEP mobile dental vehicles worth 43 million distributed to various facilities in the NCR and Region 13 in Caraga were underutilized or defective. And sabi dun sa report, exposing these properties to deterioration. Another thing, and finally, Madam Secretary, dito sa HFEP infrastructure projects with contract cost amounting to approximately 1.5 billion. Ito yung medyo na gusto ko marinig anong sagot ho dito. Approximately 1.5 billion were not yet started or not completed with the specified contract time. And nakalagay din sa report, or not utilized despite completion. Imagine, completed na, but it's not being utilized. So, again, Madam Secretary, as mentioned a while ago by Senator Mix, we're not taking on DOH, but we wanted to find out what are we doing about these issues, Madam Secretary.
Your Honor, about the mobile dental vans, these were already replaced by the suppliers, the defective ones. And for those that were underutilized in certain hospitals, we have reallocated them in other areas like local government units where it can be utilized.
Saan po yun? Saan po?
We can give you the specifics.
Siguro yun lang, pabigyan mo lang po sa atin. Tapos yung huli po, yung 1.5 billion you're talking about?
1.35 actually, Your Honor.
Okay.
And it's in various stages.
No?
Apo. It's in various stages of ongoing construction and completion. Some of them, like the one in Baguio General Hospital, have been completed.
That's what we wanted to talk about also. Buti na lang binanggit po ninyo. Kasi kami ni Senator JD went
to Baguio.
We made some commitments that we are going to raise it during the budget hearing.
Actually, Your Honor, the main issue in the completion and the start-up of facilities is usually the preparation of detailed architectural engineering design. Because of the so many end users in the hospital, we have a pro forma for new construction, but if it's upgrading and repair, because of the so many end users, there's a problem sometimes in completing the detailed architectural engineering design. And by the time it is completed, it takes also a lot of time for electrification, for wiring again an old structure.
So, it's easier to put up a new one.
Yes po.
Thank you. Madam Secretary, siguro hingi lang tayo ng latest update on the totality of the implementation. And perhaps if we can get a breakdown per region of the developments of both implemented projects and projects or programs pending implementation. At least it's good that you have a system of monitoring as to how these funds are delegated and once they are obligated until they're actually spent. We're interested in that matter, Madam Secretary.
Yes, Your Honor. We have a whole unit in the DOH Central Office that does nothing but follow up the projects, Your Honor. We can submit a detailed report.
Secretary, in the special provisions of HFEB based on the proposed SNEP for DOH budget for 2018, it is emphasized here that, and I quote, priority should be given to those located or nearby areas where there are large number of poor families or households under the National Household Targeting System for poverty reduction, or where there are no private health care facilities which can provide affordable and quality health care, close quote. Madam Secretary, what mechanisms do you see in identifying the location and the type of healthcare facilities to be given through the HFEP? May I know if it's subject to the discretion of the following DOF officials in the area, or other than that, ano po ba yung mga ginagamit nating datos para i-identify ito?
Before Secretary Bill answers, may recognize Senator Sherwin Gatchalian. I apologize, I thought I'd recognized him already. I did already, so my staff.
I'm nahingit, Madam Chair. Twice siya na-recognize kami.
Just because they're beside each other, they look alike. So,
Yes, sir. Your Honor, Madam Chair. We actually network with the local government unit in terms of prioritizing local government hospitals and health facilities. And each local government unit actually develops their province-wide investment plan on health. So with that province-wide investment plan for health, they are the ones prioritizing, and we review it, we concur with their priorities, or we...
Yung gusto nating malaman, Madam Secretary, how do you do it? Kasi in facilitating all this, for example, a local government unit would make a request. I'm sure all local LGUs would be requesting, you know, with all these facilities. So how do you prioritize? Right. If you have any concrete proposals which would justify the present system of implementing HFEPs.
Yes, Your Honor. Actually, we have 13 existing priorities for HFEP 2018. But mainly, it's working with local government units to identify the health facilities that need to be constructed and upgraded in their area. But mainly we also look at the distribution, like I need a general directive that for this HFEP, 60% will go to primary care facilities. Because before, majority of our HFEP went to hospitals, about 70%, and then 30% to primary care. But in the 2018, I made the marching order, 60% primary care, 40% hospitals. And we have a general provision, like, because the President also directed it, that 34% of the HFEP budget will go to Mindanao, even if only 24% of the population is there, because of the under-investment in Mindanao. And then Visayas is about 20%, and then the remaining balance of 56% goes to Luzon. So, may ganon. And then, we're also identifying facilities that have not been completed because of lack of funds, because we don't want white elephant. So, that's how we prioritize.
Thank you, Secretary. You know, and I also would like to just put on record that I agree with your numbers, especially when you made mention about the 60% that should go to primary. No, importante mo talaga. I have a lot of questions, but I will wind up na dun sa last dahil to give time to other colleagues. Siguro hindi ko lang mapalampas, Secretary, when I was listening to a news program, they made mention about this audit report ng failure of DOH to enact its fundamental duty of providing access to medicines and drugs. Nilagay po nila doon, nakakaano po ito no? And I just want to be clarified. Sabi po dito, they found out that 5.480 million were lodged with 3 DOH agencies, while other drugs and medicines and medical supplies amounting to 3.9 million are near expiry in 3 other DOH agencies. And then further, nakalagay po din sa report, drugs, medicines, and medical supplies worth 16.434 million in 2 regional offices remained overstocked, unutilized, idle, due to the following reasons, no? Lack of proper procurement planning, lack of coordination in the delivery, lack of monitoring and utilization or distribution. So again, every time you hear figures like this, and then pag check mo, sinasabi, yeah, may basis yan, no? This is COA report, there's this, et cetera. Siyempre, on our end as legislators, dadaan po yung budget dito, we wanted to find out para makareport din kami sa taong bayan na we did our part. And we wanted you to clarify this particular issue. For example, what is the standard ba SOP in procuring medicines on the part of DOH? Is it governed by the department order or memorandum? Do you have continuous or updated list, Madam Secretary, or registry of drugs and medicines that can be immediately distributed and stuff like that? So we wanted to get your comment on this particular issue, Madam Secretary.
Yes, Your Honor. That's true that COA year in and year out cites expired or expiring drugs and medicines. But as mentioned, and we discussed this with COA, we should set maximum cut-off, for example, because no matter how good your inventory and logistics planning is, there is no agency around the world that has no expired drugs and medicines. Because we will not pray that people will have the privilege allowable. I will tell COA that probably 5% will be allowable. And you mentioned 3.9 million and 16 million. Our total procurement for the Department of Health is 16 billion drugs and medicines. And in fact, when I was in the region, COA was telling me about 350,000.
Secretary, tayong dalawa magkakaintindihan. But if this goes in the news, radio news, TV news, and you talk to a Juan de la Cruz na pumunta sa isang health center, walang gamot, mahirap po intindihin nila. So that's why I wanted to be clarified.
We have the details for, we answered COA that there was actually an overestimation of COA of the amount. And we already have 66.74% reduction in the figures because of correction made on overstatement of value of inventories. And then we also adjusted the overstatement of value of expired medical supplies. 16.4 million is now adjusted to 2.8 million. So meron pong mga adjustments. And some expired items were also replaced by concerned suppliers because that was an agreement that was entered into when they delivered.
Thank you, Madam Secretary. Thank you, Madam Chair. I will just continue my asking questions later after. I just want to give time to some of our colleagues because it's 3 o'clock in the afternoon.
No, you can actually proceed until we're called for the session, and I was informed by the majority leader that he cannot suspend session for us to continue, so I will have to wait for the session to end by 5:30 for us to continue our hearing, and I will finish it by tonight.
Sure, I will stay here.
Yes, so I would suggest that you continue your questions so that we, and then the others can return after.
I give way to some of our colleagues who are here, Madam Chair. I don't want to take so much of their time right now.
Are they calling us already, Madam Chair?
Not yet. They'll call us. Mag-roll call na, wala pa. Pwede ka pa, magpatuloy. After Senator Villanueva, it's Senator Gatchalian, and then upon order of arrival, and then Senator Villar. But if both are yielding to Senator Villar, I recognize you now.
I just want to, there are two short questions. Yeah.
Yes.
One is your provision for operation of drug rehab center. It says it's 13. I just want to inform you that we will be operating next year, Las Piñas, and it will be operated by DOH. I hope you will have a budget for that so that it can operate by January.
Yes, Your Honor. When I informed the Department of Budget and Management that we have 8 mega treatment and about 5 regional or local treatment and rehab centers for opening, they said that we just request the budget for personnel and MOE and they will provide it. It's not in our net.
Yes, I just want to inform you because we are it's an old building and we're going to rehabilitate it. We have a donor for that, except that the operation you have to do afterwards. So I'm requesting that you take note of that in your budget because we're going to operate in January.
Yes, Your Honor.
Okay.
Our regional office has already seen the building, Your Honor.
Okay, and another one is our issue of zero defecation. There is a continuing mandamus of the Supreme Court sa Manila Bay, and it's for us to clean up Manila Bay, and one of the agencies mandated is DOH. And we have, our experience is that in the poor communities along Manila Bay, Pasig River, and Laguna Lake, there are no toilets. So I hope you will make budget for that so that we can provide toilets in these poor communities along Manila Bay because it's your responsibility. You are instructed by the Supreme Court to do this in helping the cleanup of Manila Bay.
Thank you to Senator Villar for bringing that to the attention of the DOH. Every year, we talk about the aspiration to provide all the needs for zero defecation. Perhaps you could put on record what is needed to comply, not just with the Manila Bay region, but all over the country, if we are to fund every area. I know the challenges would be the lack of land to put the public toilet in other areas, but how much funding is needed and how many toilets are needed so that each family or community would have toilets and they don't openly defecate? Do we have those numbers? And if we are to comply with the request of Senator Villar, which is very valid, to provide toilets for those living in the 3 regions for the Manila Bay region, namely NCR, 3 and 4A, and LLDA, and Laguna Lake and Pasig River, what is the budgetary implication of that? And I would like to support it. Thank you.
I just want to inform our chairman that there is no need for space because they will use their own home.
houses.
It's individual, except that the septic tank is centralized, communal. And